We have to talk about another big story a lot of people are paying attention to, a nursing strike looming in New York City. 12,000 nurses set to walk off the job in the next week, which would affect 7 hospitals across 5 boroughs. This is the latest nursing union to announce a strike in the country. We've seen this happen before in Minneapolis, Minnesota, where 15,000 nurses and 12 hospitals finally reached an agreement to avert a planned strike last month, but it happened in California and in Pennsylvania, as well as Connecticut. Joining me right now is Nancy Hagans, president of the New York State Nurses Association. Nancy, we're grateful you've made time for us now, as I know it's pretty busy for you and so many other in the medical field. But the nurses union has claimed that hospitals are not doing enough, about short staffing during this triple-demic of COVID-19, RSV, and the flu. What exactly is it that you and your nurses, your fellow nurses, want to see?
Myself and fellow nurses, what we want to see is safe nurse-to-patient ratios. We cannot go in the hospital anymore where a med-surg nurse is being asked to care for 10 to 12 patients instead of 5. We are asking hospital management to listen to the nurses to provide us safe patient-nurse ratios. That's all we're asking.
Really? So this isn't about money. This isn't about benefits like vacations. This is really about feeling safer and feeling like you can do the job every single day.
Our priorities as nurses, our patients come first. And we have exhibited that during the height of the pandemic. Our nurses went to work and did way above and beyond what we needed to do in order to save New York. At this stage right now, us nurses, we are very tired. And we cannot continue to work in the poor working conditions where we come in every day and not able to take a breather for ourselves, not able to provide the best quality of care that we need to do for our patients. Our patients deserve better. The people in New York City, our communities, they deserve better. Hospital management have to start to listen to the nurses. We need to provide better care to our patients. At the same time, we also need to have fair wages across the board in order for us to continue to provide for our family.
I have a real quick question before we get to what the hospital, at least Mount Sinai, is saying as to this nurses' strike. Was there a 5-patient to each nurse ratio prior to COVID-19, or has it been this way for quite some time and COVID just made it worse?
It has been this way for quite some time. Nurses in New York have been sounding the alarm. Before the pandemic, what happened with the pandemic, it became more and more apparent. A lot of nurses have left the profession. We still have a lot of nurses that are out with long COVID. We still have nurses that are traumatized and cannot come back to work. And hospital managements have failed to hire nurses, to replace these nurses. What we ask in management to do is to hire and retain good nurses.
Yeah, well, and that might be hard to do right now just with the staffing shortages across the board. So Mount Sinai has 3 hospitals that will be affected if the strike happens next Monday. And they released this statement saying, in part, despite our consistent good faith bargaining efforts, the union's demand for wage increases for registered nurses over 3 years is still a cost that is irresponsible and unrealistic and one we cannot accept, end quote. The hospital also stating that it has met with the union 38 times since September. So do you think there's a way that you guys will come to some sort of agreement in the next week?
Well, it's really up to the bosses, and I would like to acknowledge our fellow nurses at Columbia Presbyterian Hospital who on Saturday, the 31st, a few hours before the contract expired, did reach a tentative agreement. So as NYSNA, as members, and NYSNA urges the other 7 hospitals to follow New York Presbyterian lead and come to the table and provide a fair contract to the nurses.
All right, Nancy, we really appreciate your time, and hopefully something can get worked out so that the patients do receive the care that they deserve. Thank you again.
Absolutely. Thank you for having me.
Absolutely.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.